Good afternoon, everyone. I'm Lisa Lord. Thank you so much for joining us for this media briefing. We do apologize for starting a little late. Now, this briefing is looking at the return of face-to-face classes following the Easter break. The Minister of Education, Technological and Vocational Training, the Honourable McConney, the Chief Education Officer, Dr. Ramona Archer-Bradshaw, and the Acting Chief Medical Officer, Dr. Anton will give updates. Now, the Permanent Secretary in the Ministry of Education, Technological and Vocational Training, Ms. Alleyne-Headley, the Director of the Education Technical Management Unit, Mr. Francisco Miller, and the Deputy Chief Education Officer for Schools, Ms. Joy Adamson, are also here to take any questions. And the Minister will begin.
Thank you, Lisa. Good afternoon, Barbados. I'm moved to start with thank you. I want to say thank you on behalf of the Ministry of Education, Technological and Vocational Training for the tremendous effort that you have made over the last 2 months since Barbados commenced the return to face-to-face school in a phased process on February 21st, 2022. Now, whether you contributed your effort as parents and guardians, as principals and teachers, as education officers and boards of management, as students, as teaching assistants or nursery aides, as school monitors and janitors, as school meal servers and van drivers, as general workers or crossing guards, as public transportation drivers, and as a vigilant community and country supporting education, we thank you. We have done well together. Today is 2 months to the day that we began the transition back to face-to-face school. We came prepared with a phased plan, with a roadmap to guide implementation, with safety protocols agreed by our health partner, the Ministry of Health and Wellness, with a commitment to continue our consultation with our various partners, and with a strong belief that we could responsibly and safely return our students and the entire educational community to face-to-face instruction again. I'm happy to announce that every school has now had face-to-face instruction at some level. We would all wish, of course, that there was more, and in those situations where capacity has limited our ability to bring back all of the students to face-to-face schools every day, understand that our ministry is as anxious as the rest of the country to ensure that we get back there, and we are making every effort to move there as quickly as possible. The roadmap, which was made public, it has generally been followed. And where principals and teachers have had questions, I am proud to say that usually within 24 hours and at most 48 hours, the officers of the Ministry of Education, Technological and Vocational Studies, we have gotten back to those principals and teachers with either clarification or guidance. Safety protocols were generally followed, sanitizing, the mask, the distancing, even at satellite locations. They received additional resources to support their effort. Consultations with our educational partners, including our Ministry of Health and Wellness, it continued. And we held between February 21st, 2022 and today, approximately 10 formal meetings and a number of informal conversations to move us to where we needed to be. Many persons were concerned that there was infrastructure that needed to be done, and I'm happy to say that we have completed the capital works on 25 out of 26 of the secondary schools where we intended so to do. There is one school that is now to be completed. Electrical upgrades and audiovisual and IT resources have significantly been enhanced at a number of the schools. 7 primary schools in particular have now been completed, and this is part of a staged progression toward completing all primary and secondary schools in terms of what they will need to assist us in integrating technology in classrooms. Industrial cleaning in over 81 public schools and 11 private facilities was completed. And I shared all this simply for you to understand that this road has been one where we as a ministry have sought and a government has sought to do all things possible to make sure that we are able to make a smooth transition. Now, in updating you on how things have gone, it has been reported to me that though there were cases in schools across Barbados, that there has been no spread, according to the Ministry of Health and Wellness. What is also important is for us to understand that the Ministry of Health and Wellness continues to do its monitoring, continues to collect data, and they have informed us that the kind of cases they have seen in the school environment very much mirrors or is very similar to that which they're seeing in the wider community. We therefore have no discrepancy between the two, because we know that the schools are really just a microcosm, just a small representation of community in general. At the time when we returned to school in February of this year, you will recall that we had sent out a survey to the public asking for your feedback. Over 9,000 responses came back. And I want to say that of those 9,000 responses, over 9,000, it was 9,103 responses to be precise. Of those responses, there were 3 major concerns that were recurring in the feedback we received. 80% of the people said, we are ready to go back. But half of that 80% said, but we do have some concerns. The 3 top concerns were: 1, students not following the protocol; 2, random tests for teachers and students; and 3, access to adequate materials for sanitizing. Those were the top 3 concerns that came back from the public survey. Now, while these were not the only concerns, they occupied those top spots in people's minds. And in the interest of time, rather than look at all of the other concerns, I will highlight and speak specifically to these 3. As it comes to students not following the protocols, I am happy to report that students generally acted responsibly in managing their behavior when it came to compliance with safety protocols on the school's premises. Visits to schools and consultations with persons in this physical school environment bore this out. At some schools, even the more senior students took initiative and volunteered to be peer monitors on the premises. Prefects and head girls and head boys and other student leaders, they stepped up and they too played their part. Government invested in 240 school monitors. And while government was not able to add monitors to secondary schools, as we had been asked to do by some of the unions, the self-management of students in the secondary school demonstrated that they are capable of behaving responsibly, and the numbers bear that out. And I wish at this stage to thank, as it comes to monitoring as well, our informal partners. I wish to thank the Transport Board, our transportation partners, for the extra vigilance that they placed on their vehicles, on the vehicles that are under the charge of the Transport Board, to manage student compliance with protocols during their travel to and from schools. I want to thank you for ramping up service also at critical times to ensure that the waiting times on the roads for school children was reduced. I wish to commend at this time the principals and the teachers especially, because you made the roadmap which we made public, you made that roadmap matter by referring to it and by using it extensively. supervision at the school on the premises played a pivotal role in the safety behavior related to our health protocols. And at this stage, as I am thanking persons who have helped with supervision and monitoring, I also want to thank the Urdeston Teachers College. I also wish to thank the University of the West Indies, because in the first week, as we went back to face-to-face school, these institutions provided us with human resources in terms of teachers that who were in training, for them to sit in the classrooms with those students who had to come back face-to-face, where the teachers of those students were operating online. We ensured that the face-to-face interaction with the students happened, even when some teachers were unable to be there physically. Those teachers in training stepped up and provided the on-the-spot, in-school, on-the-premises supervision for our students. And we thank you. We were truly all in this together. A second area of concern was that of random tests for teachers and students. And on the matter of random testing, you will recall that the Chief Medical Officer who spoke with us back at the time when we had our initial press conference had indicated that random testing may have been for surveillance purposes only. Now, the Ministry of Health and Wellness have informed the Ministry of Education that the swabs to facilitate the random testing of students and teachers have not yet arrived on the island. And with the COVID climate being dynamic and changing from day to day, we all certainly remain open to reviewing the considerations around random testing. The third top three of the concerns reflected in the surveys from the public was access to adequate materials in the schools to sanitize. And I want to say that we have reached out to our international partners and our local partners. And as a result, during this experience from February the 21st until the end of term 2, we have been able to augment the supplies that the government itself has invested in by ensuring that we are able to receive contributions for materials to sanitize and to keep others safe. And in that regard, without going into all the details, it was certainly more than 1,500 sanitizing stations for nursery, primary, and secondary schools that we have received. We have brought in over 250 face shields for our special needs students who cannot wear masks in many cases. And also we have increased the supplies of soaps and sanitizers. Over 11,200 disposable masks were provided, 4,992 cloth masks, and just this week we received an additional 8,000 masks from the Pan American Health Organization, and we expect to have those in schools when the third term begins. I will not even go into the numbers of sanitizing spray and other materials which we have ensured have been made available in the schools to address that third top concern of those persons who gave us their feedback. Another matter which was raised was the vaccination rate. Now, the vaccination rate for eligible students, from what I am told, that is for 12 years and over, I am told it is in the vicinity of about 50.7%. And we would like, as a ministry, to see that go higher. Our scientists and our advisors are telling us that indeed the vaccine offers another layer of protection, and we would wish to be able to encourage all persons to add as many layers as they can to their own responsible safety protocol. The Ministry of Education, Technological and Vocational Training, along with the Ministry of Health and Wellness, we are collaborating to make sure we can deploy a vaccination bus that will then be going to schools to assist us in raising the level of vaccination. I want to encourage you, parents. I want to encourage you that when you see the link come to your mailboxes, please click on the link and sign your child up for vaccinations. This is important that you do this, not just to get them vaccinated, but also in indicating your consent. You allow us to plan, because if we know that there are 50 students at school X who will be requiring vaccines and there are 30 more here and there are 100 over there, we're better able to deploy resources and to ensure that we have the adequate materials and the adequate supplies to be able to service you, and that we can schedule in an appropriate manner. The Chief Education Officer can indeed tell you a little bit more about the vaccine bus later. Now let's get to what you all really want to know about Term 3. Barbados, we have had the ultimate test, the test of an authentic, real-life experience to test our capacity to responsibly and safely conduct face-to-face school. We had that experience during Term 2. Ventilation, wearing masks, our sanitizing, our physical distancing, not less than 3 feet, our personal responsibility, these were all part of what worked well. And we ask you, as we continue moving into Term 3, to please continue those things we have done well. That said, the official start of Term 3 will be on Monday, April the 25th, 2022. That is next Monday. Only teachers will come to school on Monday, and students will come to school to start on Tuesday, April 26th. Let me repeat that. On Monday, April 25th, Term 3 officially starts. Teachers go in on the first day. Students go in on the Tuesday, the next day, the 26th of April. Now, due to our capacity constraints, not all schools, not all students can go back face-to-face on April 26th. But everyone will receive instruction from April 26th. So while not all students will be face-to-face, all will receive instruction. And I am asking you to take your cue from the principals who will be sending out correspondence to parents on which students are to come to school on which day. Until such time as we are able to remove the 3-foot distance completely or to find additional space, schools will resume the blended approach which we have started. Believe me, I understand that we all want to be able to get every child back into school. Our ministry is with you on this. Our Ministry of Health and Wellness, our health partner, they are on board with this. We have to be able to take a stepped approach that works for Barbados. And until the 3-foot distance is no longer a part of that, or we are able to acquire additional space, then we will have to continue with the blended approach. We are certainly going to ensure that our work with the Ministry of Health and Wellness continues to make this come sooner. Schools will close at 2 p.m. for public schools. Extracurricular activities will continue following the same protocols as before, and all children will be expected to wear your full uniforms. Now, as for learning supports, those who are doing the Caribbean secondary examinations and the CAPE students. There will be learning development support. There's a learning development and exam preparation success scheme that is there to assist you where there are deficits or loss. There are workshops on helping study habits, and we are asking you to please, all schools, to please tap into that support which is being provided through the ministry to be able to support those students who are doing CSEC and CAPE. We are also working on support programs for the Class 3 and Class 4 students. We are hoping to refine these programs based on observations of our education officers. And we know that those programs are still being developed, and I know that the Chief Education Officer may very well touch on these programs, because at the forefront of all that we are doing is to improve the quality of education and the outcomes for all of our students. So, as we head into term 3, I wish the very best to all of the students who will be taking the various exams, to the entire team at the Ministry of Education, Technological and Vocational Training, and in our schools. I want to thank you for your unwavering service and your support. Let us now continue to hold space for each other, and especially for our students, as we continue this journey toward a full return to face-to-face school. Thank you.
Thank you very much, Lisa. Good afternoon, Barbados. I want to join the Minister of Education, Technological and Vocational Training in thanking all of our education partners. The team at the Ministry of Education, Deputy Chiefs, and the rest of the team, the principals, the parents, teachers, support staff, for making term 2 not only a reality, but a success. It was truly all hands on deck. And I must say, walking side by side with us was the Ministry of Health and Wellness, who guided us every step of the way. We had meetings bi-weekly, every 2 weeks or thereabout, to discuss the progress, the risks, how we could improve, and this is how we made it through term 2. So thanks again to all of the education partners. I spoke about evaluating risks, and that was indeed a very important point for us. At every step of the way, we evaluated whether it was safer for the students to be in school or safer for them to be out of school. And today is no different. Through all of the meetings that we've had, we've decided that the risk of keeping our children at home, keeping them online, is too great. There is a lot of fallout, a lot of loss. You have social loss, emotional loss, in general learning loss. So the decision to have school starting from the 25th, starting from next week, Monday for teachers, and next week, Tuesday for students, was based on information, the best information available. And I will tell you, the public, that we will continue to work with all of our partners in education to consistently evaluate the risks, to consistently mitigate the risks, and put plans in place to ensure that our children are safe When we look at our neighbors across the Caribbean and on conducting an investigation into those who will be opening for term 3, it was seen that across the region, a number of countries, Anguilla, Antigua and Barbuda, Belize, BVI, Trinidad and Tobago, Jamaica, Montserrat, St. Kitts and Nevis, and the list can go on. Those countries are looking to open in term 3 as well. Like us, I believe that they have been evaluating the risks, and our children need to be in school, but we will make sure that they are in school safely. The minister spoke about the ending of the school day, and I will reiterate that, 2 p.m. for public schools. In terms of uniforms, we expect full uniforms to be worn in term 3. But one of the things that I want to spend some time talking about this afternoon is the reason that we're here. The reason that the Ministry of Education exists, about our students, their learning, and of course the teaching that will take place to enable their learning. Throughout the time that we've been meeting with the principals and the unions and the various associations, with the NCPTA, it had been said that the students across the system have displayed a lack of social skill, not skills, not all of them, some of them, lack of social skills, lack of motor skills. Some of them are not so interested in homework anymore. And we can understand that that can occur due to the fact that the students had 2 years of online teaching. And of course, coming back now into the face-to-face environment, we have to reiterate certain things, or we have to teach certain things afresh. In our meetings with the principals, and these are meetings that we had just recently with them, we had identified some ways that they could meet the students at their point of need. And I commend the principals, the management teams, and the teachers at this point in time, because over the course of last term, they did what they could to evaluate the students, to identify their strengths and weaknesses, build upon the strengths and consolidate the weaknesses. So I commend them for that. So at the school level, the principals and the teachers have been addressing these situations, and they have been meeting the students at their point of need. However, the Ministry of Education will develop, as the minister said, further programs to assist our students at the class 3 and the class 4 level. We will ensure that the students are exposed to a program that will help to build not only their cognitive abilities, but can help them to develop the correct attitudes and to build certain skills. So this will be rolled out pretty soon. As soon as it is about to be rolled out, we will share it with the public. With regard to the students who are pursuing the CSEC and the CAPE, we have developed what is called a learning development and examination success preparation scheme, and that has been working quite well. In that scheme, we've had a number of workshops for our students at the secondary level, those in 4th, 5th, and 6th form. These workshops included study habits, We conducted surveys to find out the subject areas that they would need the help in. And we have to date offered seminars and workshops for students in those areas. In fact, today was the last day for our literacy and numeracy clinics. We will continue to have workshops in other subject areas as identified by students as well. So at the school level, we are addressing these deficiencies, and at the ministry level, we are also addressing these deficiencies. When it comes to the teachers, the Ministry of Education, in collaboration with Erdiston Teachers Training College, over the Easter vacation, offered courses in a number of areas, leadership, social emotional learning, to our teachers. And we had quite a good uptake there. So we recognize that we have to assist our students, and we are putting mechanisms in place. We continue to put mechanisms in place to assist our teachers and our students. I will speak now about the vaccine bus. The minister mentioned that. The Ministry of Health and Wellness and the Ministry of Education will work together to deploy a bus. This bus will go around from school to school. But before we get there, of course, we have disseminated through the principals a form, an electronic form, that we're asking parents to complete. Parents, if you have not yet seen that form, please go into your children's inbox, the Gmail inboxes, and locate that form. Because as the minister rightly said, the vaccine offers an extra layer of protection, and it would be a good thing for your children to receive the vaccination. The minister also spoke about the fact that our children will be accessing classes on a rotational basis. Some of them, where we don't have the capacity, the students will be accessing classes on a rotational basis. Parents, I'm going to ask you to be extremely vigilant. Please check the schedules to ensure that the days that you have dressed your children for school are the days that they're supposed to go to school. We found last term that there were some parents who decided that they will send the children to school every day, even though they knew that the child was only required to go to school, physical school, 3 times in the week. So I'm going to ask you not to do that, parents, to our teachers and to our principals, because when your child shows up on a day that he or she is not supposed to be there, it puts undue stress and undue pressure on the school. First, we have to find the space for him or for her. We may not have that space readily available. The child may have to sit outside. And you don't want that for your children, and I don't want that for your child either. So I'm going to ask you to pay attention to that. Last term, we found also that there were some parents who sent the children to school with only 1 mask, the mask that they were wearing. Parents, make sure that your children have at least 3 masks. Just in case the one that they're wearing it drops or something happens to it, they have additional masks. The next thing that we realized, some parents were sending children to school sick. And I'm so happy that we have very vigilant monitors and vigilant teachers and support staff who could say, well, you know, something is wrong here. Let us isolate. But parents, you don't want to give them that stress either. So help us to help you. Check your children before they leave home. If you know that they're sick, do not send them to school. Please do not send them to school. Stay home with them. Take them to get tested. If you don't know if they have COVID, take them to get tested. And I'm sure that the medical officers of health will give the advice that is needed to ensure that the children bounce back and they're ready to come back to school. Remember also, parents, your children may not have COVID, but they may be home for some other reason. The medical certificates are still in effect. So if your child has been out of school for 3 days or more, you have to take to the school a medical certificate. I know that many of you helped and did your part last term. I want that even more of you do your part this term. With that said, I look forward to collaborating with all of the partners in education. I heard the minister mention the transport board and the role that they have been playing, so I thank them as well. I also want to thank the Alliance of Owners of Public Transport. We met with them as well, and they've been playing their part. So I want to thank them as well. So we look forward to working with you in term 3. We look forward to having our bi-weekly meetings with our stakeholders, listening to the challenges and putting measures in place to see how we can make it even safer within our schools. Thank you very much.
And thank you, Dr. Archer-Bradshaw. From the Chief Education Officer, we go to the Acting Chief Medical Officer, Dr. Best.
Thank you, Ms. Lord. Apologies. Let me start again. Thank you, Ms. Lord, and good evening to all viewers. I'm truly honored to be a part of this panel this afternoon as we speak about COVID-19 in schools and the risk presented to the young ones in our nation. So let me thank the Ministry of Education team led by the Honorable Minister McConney for their leadership and their stewardship and the partnership that we've had, especially over the last few months. Before I get into the details about what we've been seeing in terms of disease surveillance in persons between the ages of 3 to 18, let me just set the tone by talking about the general statistics, what it is that we're seeing nationally. So according to the dashboard released today and covering the period of April 20th, which was yesterday, we had 547 new cases out of 1,645 tests done. The majority of those cases were female at 324, with 223 being men. There were no reported deaths in the last 24 hours. Over the last 3 weeks, we recorded in Barbados just over 7,000 new COVID cases, with the average age of a case being about 36. We've noticed that our positivity rate is about 32%, which is very high, and this is a 7-day average that we're looking at. In terms of the 7-day moving average of the number of cases, we are currently at 340 cases per day. And approximately 3% of all of those positive cases in recent weeks have been admitted to hospital. Between the periods April 11th to April 16th, we diagnosed 329 new infections, which gives us a 7-day cumulative incidence of about 810 per 100,000 population, which is well in excess of the 500 per 100,000 population benchmark that we customarily look towards. Other indicators include the reproductive number. As of April 14th, we estimated that the reproductive number is about 1.13. And just as a reminder, the reproductive number is basically saying the number of cases that will lead to additional cases of COVID-19. So if you have one case of COVID-19, you would get 1.13 cases, or the better way to put this is if you had 100 cases of COVID, that would result in 113 cases. So this particular indicator, once it is greater than 1, is telling us that our epidemic continues to grow. However, I will say that there is some slowing down, because when we last reported the reproductive number about 2 weeks ago, that value was about 1.47. The doubling time is about 10.5 days, and this doubling time is getting larger, or longer rather. It was as low as 4 days just about 2 weeks ago. So there is some slowing down of the epidemic. In terms of the number of daily admissions to hospital, we're currently averaging at about 9 cases per day, and that's looking at the last 7 days. In terms of total deaths, we've reported 386 deaths, and when you take that into consideration with the total number of cases, we get a case fatality rate of 0.6%, which is one of the lowest case fatality rates in the world. The average age, unfortunately, of someone who's died from COVID is about 70 years old, and the range of persons dying from COVID in the last 2 years has been 14 to 104. We would have announced last week that we sent samples to the CARFA labs in Trinidad for genomic sequencing. Prior to that, we did have a very strong suspicion that this was BA.2 at play. Just as a reminder, BA.2 is a subvariant of Omicron, and it is Omicron, which is the variant of concern that we have been dealing with since January. The BA.2 subvariant is a particularly naughty guy because it is far more transmissible than the BA.1 variant, which was more transmissible than the previous variant of concern, which was Delta, which plagued us towards the end of 2021. So 90% of the samples that we sent came back positive for BA.2, so this would explain the high rate of cases that we are experiencing here in Barbados. Let us take a look at what we're seeing in the pediatric population. So when I say pediatric population, for the purposes of school, I'm specifically referring to children between the ages of 3 to 18 years old. When we looked at the data between the 21st of February and the 8th of April at the end of the school term, we had just over 1,600 cases in that particular age group. This works out to about 60 cases per 1,000 school population over that entire period. To date, our analysis has shown that the rate of infection is slightly higher in the primary school kids compared to those in the secondary school. And specifically, I'm talking about the cumulative incidence per 1,000. And in the primary school population, and that is kids between the ages of 3 and 11, that is 17 cases per 1,000 population. And among children in the secondary school population, that's children between the ages of 12 and 18, the rate was 14 per 1,000 population. So that gives us an overall cumulative incidence of 15 cases per 1,000 population over the last 7 days. I have to stress that serious outcomes from COVID-19 infections continue to be rare among school-age children in Barbados. So what are some of the take-home messages? Although we are in the midst of a COVID-19 surge with very high rates in Barbados, the Emergency Operations Center, the Ministry of Health and Wellness, has not advised on the introduction of any new public health and social measures such as curfews, lockdowns, and in that same vein, we are advising that schools remain open. Best available evidence suggests that the resumption of face-to-face schools has been very safe with respect to the risk to children and to staff in terms of them acquiring COVID-19. School protocols are working. That is a take-home message from this brief presentation when we looked at the data, and that is a message that was stated earlier in the earlier presentations. And one key point that I want to make is that schools must be regarded as essential services, and they are not major drivers of COVID transmission in Barbados. I want to end this very brief presentation by thanking the Ministry of Education colleagues, and I also want to especially acknowledge the public health professionals, those working at the polyclinics, in particular the medical officers of health along with their teams, who work hand in hand with the schools and the principals to advise them what to do when a case is detected within the schools, to make sure that the protocols are in place. And I have to stress the value of partnership. The Ministry of Health can't do this alone. The Ministry of Education can't do this alone. Everybody has to play a role in ensuring that the roadmap is implemented as efficiently as possible. And let me say that the roadmap is working. So let me remind all of Barbados that the Ministry of Health will remain vigilant where COVID-19 is concerned, and we will continue to provide the best evidence-informed and scientifically sound policy recommendations where schools are concerned. We want to keep all of our kids safe. But we cannot do this alone. So I beg your indulgence, and I crave and hope that you will understand what it is that we are doing, and that you will continue to cooperate as we keep all of Barbados as safe as possible. Thank you.
And thank you very much, Dr. Best. As we open the floor for questions, I would just invite members of the media to identify themselves and the media house they represent before posing their questions. Members of the media? Members of the media, are you hearing me? Right, we seem to be experiencing some technical issues. Just give us a moment. Members of the media, are you hearing me? Members of the media, are you hearing me? Good afternoon.
Yes, Lisa, good afternoon.
Good afternoon, Barry.
Can you hear us?
We can hear you. Yes, we can.
Hi, good afternoon. This is Barry Alleyne from the Nation newspaper. My first two questions are for the Deputy Chief Medical Officer. That would be Dr. Best. Good afternoon, Dr. Best. My first question is with regard to the children. You just produced some data for us in terms of infection rates of children at schools. Can you speak to how symptomatic the children who have contracted COVID-19 in Barbados are? Are they becoming ill, or generally speaking, were they mostly asymptomatic even though they were positive for the COVID-19 virus? Can you answer that question first?
Thanks a lot, Barry. That's a very good question. Unfortunately, we do not collect data to look at the numbers of children and the symptoms that they have, whether they're asymptomatic or whether they do have symptoms and are mild. What I can tell you from experience is that the vast majority of children have had mild symptoms, and usually it is the mild symptoms that they bring to the attention of their parents or their guardians, and that is when they're tested for COVID and diagnosed with COVID. What I can also tell you is that we have not been seeing any severe cases of COVID amongst that population in Barbados. And certainly we have not been seeing any deaths in recent times.
And the second question, Dr. Best, is this. As you're aware, most of the teachers that do teach in Barbados would go back home, and they would go back to their communities and their households, and we are aware of the level of that exists in our community. Can you speak to the level of infections, if we've had any, of our teaching fraternity, and is that seen as an issue at this stage, or it's been generally mostly the kids that have been contracting the virus?
Thanks a lot, Barry. So in the presentation, I would have talked about what we know from our surveillance data, what is happening in all persons in Barbados between the ages of 3 to 18. What I did not talk about, but we do have some data, is the rate of infections amongst the staff at the institutions. So we have had a number of staff who have had COVID. What your question is suggesting quite correctly is that they're part of the community. All right. So we have detected cases amongst staff, and the same protocols apply. And of course, the protocols that I'm referring to would be isolation and management in the home isolation program as deemed appropriate.
The question I should have asked Dr. Best, though, is are public health officials right now concerned about that level of infection within staff, or is it what you would say would be expected numbers?
So Barry, what I was suggesting, and I need to be very clear, is that the numbers are nothing untoward. They're not suggesting that there's any cause of concern. The other point that I want to make is that with the numbers that we're seeing in the schools, in terms of the positivity rate, the positivity rates are equivalent to what we're seeing in the community. And so far, we have no evidence of transmission happening in schools. And that is a key point that I need to make, that the roadmap that we developed, the roadmap that we're implementing with all of our partners, is protecting not only the staff, but is protecting the students, and is helping keep the rates as low as possible in the communities. And the roadmap that I'm referring to is the roadmap for the resumption of face-to-face schools in Barbados.
Thank you, Doc.
You're welcome.
Are there any further questions? Barry, you're still hearing me?
I'm still hearing you. I was
Okay,
waiting
I just
for
wanted to
anyone
make sure that
who
our
wanted to ask a question. Yeah.
Okay. I'm not hearing anyone else, Barry, so I'm not sure if you had a follow-up.
Well, I do have a follow-up for the Chief Education Officer, Dr. Bradshaw. Chief, can you give us an early indication as to what has been the response by parents consent forms? Or is the interest high already? Are a lot of parents saying, yes, we want our kids to get vaccinated? And secondly, how soon do you expect that vaccination bus to hit the road? The first week of the term 3 or a little further into the term? What's the position with rollout for the vaccination bus?
Thank you for that question. I must say that the response rate to the vaccination form is relatively high so far. I checked about 2 hours ago and I saw 130 names of students across schools. So I believe that after this press conference, we will have an increase in the number of names, because parents should now be aware that they have to check the inboxes of their children for that form, so that they can put their children's name down. I want it to be very clear that the medical officer of health or the nurse will not be vaccinated any child without the parental consent. So parents, if you want your children to be vaccinated, make sure that you sign them up. Check your children's inbox for that form. The principals disseminated the form.
Thank you, Chief.
Yes.
Quick, you would have mentioned in your presentation about learning loss previously, before we returned to face-to-face classes, and you also mentioned some programs that you expect your teachers to start with, what we would consider the students who had dropped back a bit from the online teaching. Can you indicate if those special programs will come into play in the upcoming term 3, or is that something you envision starting in the new school year in September?
No, those programs will begin in term 3. That will be for the primary school. But the ones for the CSEC and CAPE students have already started. We are moving full steam ahead with those. But based on what we've been seeing at the primary level, we want to ensure that the programs that we design and develop are meaningful and relevant. We want to make informed decisions when it comes to the creation of those programs. And this is the reason that we're looking at implementing them in term 3, and we didn't rush to implement them at the beginning of term 2, because we needed to gauge where our children are. We needed to identify what the problems are so we can cater effectively to those problems.
Chief, in that very short time frame between when school restarted in February and now, have you been reported to the ministry by the principals that they're starting to see some movement upward again now that the students are back in class? Those students who have started to lag a bit, was the return to face-to-face, did that help them try to come back, get their heads back above water?
Well, I've been receiving positive reports from the principals. You know, our children had been online for a little while, 2 years. Many of our teachers were extremely happy to see the children back face-to-face, and the children were equally happy to see their teachers. When children are comfortable, when children feel safe, they learn. So I can tell you, based on the meetings that we've had, based on the reports of principals, they're working with the children, they're working to bring about improvement in the learning, and they will continue to do so. So of course, because the children feel safe, because they're comfortable, because they're not now only focusing on one type of learning, but they're able to develop their social skills, you know, their attitudes and so on. It is a positive thing, it is a good thing, and we are seeing the positive growth that you've asked about. You asked a question about the vaccine bus. I have to answer that question for you. The Ministry of Health and Wellness had spoken about that bus, and they will deploy that bus as soon as possible.
Thank you, Chief.
You're welcome.
Are there any further questions? Barry, you're still hearing me, right?
I'm still hearing you. And if
Okay.
no one else has I have a final question.
Go
for
right
Dr.
ahead,
Bess.
Barry. Go right ahead.
Dr. Bess, Dr. George had noted before that Barbados continues to try to procure vaccines for children 12 years and under. What was the latest report on that?
Thanks a lot, Barry. The Ministry of Health and Wellness continues to try to get the vaccines for the individuals between the ages of 5 to 11. That is a particular Pfizer vaccine. It is not the same Pfizer vaccine in terms of its constituents, same active ingredient. So you cannot take what you would give an adult and simply dilute it and give a child. So you have to procure the specific Pfizer vaccine for children in that age group. Hopefully within the next 2 weeks we will have some. We are working assiduously to try to procure some, and that is the most that I can tell you right now. We don't have it, but we are working towards getting it.
Thank you. And Lisa, if you would indulge me, I do have one final question for the Chief
Of course,
Education
Barry.
Officer.
A final one.
Final one, yes. Chief, can you give the country any update with regard to there was a particular narrative early on with some claims of discrimination being meted out male Rastafarians in school regarding their locks. And members of the African Heritage Foundation in particular had claimed that there was a particular bias being shown towards these kids who are wearing their locks. Can you speak to that, and if any dialogue has been had with the ministry and our Rastafarian community and going forward? Has there been any resolution in this?
All right, I want to say up front that the Ministry of Education does not discriminate against anyone. So I want to say that up front, Rastafarian or otherwise. Now, we understood that there was some concern with regard to children returning to school with extremely long hair when term 2 began. I met with the principals and they expressed the concern that the students were not complying with the rules as established. Now, I know that we had been away from physical school for a while. It does not mean, though, that we are throwing away the rules that existed. Now, while I understand that given how the world is moving, there's a need to relook certain policies, we still have to look at what exists right now. What I can say is that we've met as a ministry. I've had conversation also with the minister, and we are looking to see how we can review that policy so that we can be even more inclusive. If the children have locks and they're Rastafarian, they need to wear a tam. The rules say that. So I'm going to ask all parents again to take a look at the rule book and follow the rules as they are laid out. But we will be looking to make the changes so that we don't discriminate against anyone.
That matter will be fast-tracked, Chief. Is that on your front burner?
Very much so. And it's on the minister's front burner as well. Very much so.
Thank you so much.
I'm just checking to see if my colleagues in the media have any further questions. I don't want to disadvantage anyone. Okay, I'm not hearing anyone. Barry, you are satisfied? I believe you are. Minister, I'll give you closing.
Lisa, thank you very much.
You're welcome. Minister, I'll give you closing comments.
Thank you very much, Lisa. I simply want to say at this time that we are continuing to go to school. To face-to-face school. The Ministry of Health and Wellness has given us the go-ahead. Schools will remain open. Schools will start this, face-to-face school will start this coming Monday, April the 25th. Students, you start on April the 26th. Please look out for the dates on which you are to go to school. We will continue in a hybrid format until such time as we are able to remove that 3-foot distance and expand, therefore, the capacity of our classrooms to hold more students. The experience of term 2 should give us all cause to feel good about what we can do and to build our confidence that as we move in to term 3, we will be able to do so safely and responsibly, and to ensure that while we expect there to be cases, that we will be able to contain any spread and ensure that there is indeed no spread. Some people have asked about the roadmap. There is a pop-up roadmap on the Media Resource Department's site, mrd.gov.bb. If you can go there, those who are still asking about the roadmap, please go there and you will be able to find it. And the final comment is for those of you who have not yet had your vaccine, please sign up on that electronic link we have sent you. Parents, please sign your children up and let's get those vaccine rates up and continue to keep schools safe in the third and final term of the 2021-2022 school year.
Thank you very much, Minister. That was the Minister of Education, Technological and Vocational Training, the Honorable K. McConney. Let me also thank the Chief Education Officer, Dr. Ramona Archer-Bradshaw, the Acting Chief Medical Officer, Dr. Anton, who all gave updates. We were also joined by the Permanent Secretary in the Ministry of Education, Technological and Vocational Training, Ms. Betty Alleyne-Headley, the Director of the Education Technical Management Unit, Mr. Francisco Miller, and the Deputy Chief Education Officer for Schools, Ms. Joy Adamson. Members of the media, thank you, and you as well for joining. Good afternoon.
Thank you. How long are you active?